Hello and welcome to the Flipside with Dr. Michael Nichols. This is episode number 2, and I am so excited for this episode. I think it's going to be a really good one. I think you're going to get a lot out of it. I think you're going to enjoy it. So, what are we talking about today? Well, today I am going to be talking about MAHA. MAHA, M-A-H-A. Now, for some people, they hear that term MAHA, they automatically start to think negative thoughts. And for others, they hear it and they get very excited. It's a real odd, dichotomous thing that occurs with this term MAHA. If you're not familiar with MAHA, which would be kind of surprising because it's been all over the place for the past year and a half, MAHA stands for Make America Healthy Again. Now, because Robert Kennedy Jr. sided with Trump for the election, that has been related to MAGA, Make America Great Again. And of course, it is a playoff of that. But the thing that needs to be made very clear right up here at the front is that this is not, I was going to say it's not a political thing. Let me backstep that a little bit, because of course there is politics involved in this. There's quite a bit of politics involved in this, but this is not a Republican or Democrat thing. This is not a Trump thing. This is not a Biden thing. This is not a one-sided conversation. It's not, and it shouldn't be. The problem is there's a lot of people who want to make it as such. And let me actually rephrase that and say it's probably not a lot of people. There is a certain person, a certain individual, a certain type of individual that wants to turn this into a completely lopsided political viewpoint and turn it into something that it's not, so that they can eliminate it. Now, of course, this is my opinion. I think the evidence kind of speaks for itself on my side when saying this, but that is the case. So I'm going to pretend a little bit like the viewer is not familiar with MAHA and do a little bit of an explanation with this, because I think it is warranted. And in honor of this presentation today, I wore one of my favorite shirts here. I'll take the camera and I'll bring it down. Yay! Kennedy for president. Yes. Well, we know how that turned out. It did not turn out the way we as cheerleaders for Bobby wanted it to turn out, but it still turned out, or hopefully is going to turn out, in the direction that we wish it to wholeheartedly turn towards, and that is his confirmation as head of the NIH. And we're going to talk about that because that is part of this whole MAHA movement. We need to talk about Bobby. We need to talk about his character and the slander and the attacks that go against him. We need to talk about all that stuff because it's all part and parcel of this whole package of MAHA. Excuse me. So before we do that, I want to say, if you tuned in for the last episode, hey, thanks. I really appreciate it. I liked the way it turned out. I think it was a good way to start off, because philosophy is a really important aspect of everything that we do in life. And when it comes to our health decisions and the way that we think about health, and even politically, the way we think about health and the directions that things will go to, the way that we think about MAHA and that movement, all revolve around the philosophies that we either know or don't know that are residing inside of our brain. So I appreciate you tuning into that. If you haven't followed yet, please do so. At the beginning of this episode and at the end of it, you will have seen at the beginning, and you're going to see again at the end, the link to go to my link tree that has all of my different social media on it. So Facebook, etc. So if you can follow that stuff, that would be fantastic. Join the newsletter for future posts that might be coming up and future topics. And I would really appreciate it. It helps a lot in the growth of this podcast to reach more people. And I hope that you are getting something out of it so that you really want to help me reach more people with this. So So what I want to do first is let's explain MAHA. Let's explain what Make America Healthy Great, Make America Healthy Again means. What does it stand for? There are misconceptions out there. For many of you, I don't know how many have this viewpoint, kind of irrelevant, I guess, but for many of you, you may have the viewpoint that the mainstream media has not been the most honest here in the past 5 years, maybe longer than that. I would tell you much longer than that when it comes to certain topics. But there has been a concentrated effort to try to demonize Bobby Kennedy and make this whole movement out to be something that it's not, or to be make it seem like this movement is an exaggeration and that we are not in the dire position that some people talk about in the MAHA movement. So what is the reality? What is the reality of all this? First, let's talk about the MAHA movement. So I'm going to actually share a screen here with you. I'm going to share a lot of screens here today because I want to show you evidence of things too, not just my opinion. So we're going to come over here to, well, what are we looking at here? Here we go. All right, this is what we want to do. We're going to come right over here to this. Pardon my messing around here. Here we go. All right, so hide that panel. All right, I'm going to move this over here. So this is the website for Make America Healthy Again. And if you come here, you can actually read what they state are their positions. So instead of me just trying to memorize it and repeat it, I'm going to actually read it for you right here. Their key issues and policies. So I'm going to actually read this whole thing because I want you to really understand what the MAHA movement, what the people who are really involved in MAHA, what it is we believe. And I'm going to say we because I am involved in the MAHA and I really wholeheartedly support everything that's on this agenda. So key issues and policies. Make America Healthy Again is built around a commitment to addressing some of the most pressing issues facing our nation today. These issues not only affect public health, but also the integrity of our environment and the transparency of our government. MAHA's key issues and policy priorities are the chronic disease epidemic. MAHA's policy focus advocates for a comprehensive national strategy to combat the chronic disease epidemic, which includes addressing the root causes such as poor diet, environmental toxins, and inadequate health care. The PAC supports policies that promote preventative health care, increase access to nutritious food, and reduce the environmental factors contributing to chronic illness like cancer, diabetes, heart disease. I'm going to interrupt for a second and just say something. When you read this, what do you think when you read this or when you hear this? Do you think, oh, I should fight against that? That's Bobby Kennedy supporting that, so it must be wrong. There must be something wrong with that. Or does your brain hear that and say, chronic disease epidemic that's affecting our nation worldwide, really, but our nation especially. America is being affected by a chronic disease epidemic of staggering proportions, and it truly is an epidemic. And who can't get behind that? And if someone is arguing against this, why? That should be a huge question in your mind if you hear someone arguing against what MAHA stands for, because this is at the center point. This is the number one thing in the MAHA movement, is this chronic disease epidemic. Bobby Kennedy has made it his life's mission to help children. That's his primary passion, is helping children become healthier in America. And he's done it in a lot of different ways, and he's done it for decades. And so this is just part of that. And we're going to talk more about this chronic disease epidemic, why it is so important, why it is an epidemic, and hopefully get all the viewers out there inspired by this movement, because it really is going to be an important thing to have to change in America. Next thing on here is regenerative agriculture. MAHA champions regenerative agriculture as a solution to many of America's health and environmental challenges. This includes supporting policies that incentivize sustainable farming practices, improve soil health, reduce chemical usage, and increase biodiversity. Regenerative agriculture not only produces healthier food, but also contributes to carbon sequestration. That's a tough word there. And the fight against climate change. I'm going to read the next one here first because they're going to kind of go together. Habitat preservation. Protecting America's natural habitats is crucial for both environmental sustainability and public health. MAHA supports policies that preserve and restore natural ecosystems, should be a space there, and curb the destruction of vital habitats caused by industrial agricultural expansion. This includes advocating for stronger environmental regulations and enforcement to prevent habit loss and degradation. The two of these really go together as a topic. And once again, especially on the Democrats side of thing, which are typically the people who are attacking Bobby, one of the reasons they're attacking Bobby is because there's this, and I'm assuming certain things here when I say this, but there seems to be this Bobby helped Trump get elected, therefore we should hate RFK Jr. We should hate him. We should support anything that goes against him. If the newspapers create some kind of slanderous thing, we should believe it because RFK Jr. helped Trump get elected. And that's kind of the mindset. Now, to me, that's an insane mindset. Sorry if that's your mindset, but I think that's kind of crazy because RFK Jr. is his own person. And before he was ever part of the Trump campaign, he was running for president. He tried to get put into office as a Democrat. He's been a lifelong Democrat, but the Democratic Party turned him down cold, didn't even want to discuss things with him. Trump opened up his doors and said that if he came aboard, he would support his movement. And so far, that's what we are seeing, and that's what we're going to hope we keep seeing. I have a lot of hope that it will be. But let's look at this. The Democratic side always says, hey, Trump is against the environment. But guess what? This is the MAHA movement. This is what the MAHA movement is trying to do. And Trump is supporting Kennedy in his passion towards this. And there's other evidence of that as well. Only time will tell what's going to actually happen. But if the passion that is behind MAHA is allowed to grow and to do what it needs to do, this is part of that. And this is not only good for the environment as a general whole, but when it comes, once again, back to that chronic disease epidemic, these are some of those base root things that have to be changed to start to change chronic disease in America, because we have to change the way we look at food. We have to change not only the way we look at food in the sense of what we put in our mouths, what we eat, but how it's grown, how it's subsidized or not subsidized, how it's paid for by the government, how it's promoted, and just the health of the food from soil to the person. And that's really what we're talking about here. The next thing there, combating corporate corruption. MAHA is committed to exposing and dismantling the corporate takeover of government agencies that are supposed to protect public health and the environment. The PAC supports policies that increase transparency and accountability in government, reduce the influence of corporate money in politics, and ensure that regulatory agencies operate in the public interest, not at the behest of corporate donors. Once again, you read that sentence. Would you argue for accountability in government? Would you argue against reducing influence by corporations in politics? Would you argue trying to improve regulatory agencies so that they are operating in your interest, not the corporate donors? How can anybody really argue that? The side that is running ads and campaigns against Bobby and against this movement have interests in this. They want to see this side of things continue the way it's been continuing. They want the money to keep rolling in. Don't fool yourself. It's not about anything that they can say negative against RFK Jr. There's nothing that they can say, number one, that's going to end up being proven as anything substantial in the long run. But the other part of it is the only reason they're slandering him is so that they can stop this. And I will tell you, this is the heart of it right there. They will deny the chronic disease epidemic. They will rail on about Trump being bad against the environment so that this is not going to happen. They will say anything and everything because this This bullet point right here is the part that scares them to death. They are so scared. They are running around. The old expression was like chickens with their heads cut off. They don't know what the hell's going on. The sky is falling for them because this is what scares them. And they will do anything to stop it. Anything. Keep that in mind when you hear anything negative about what's going on with MAHA. Anybody that puts MAHA in a negative spin is because of this. 100%. No doubt in my mind whatsoever. Every fiber of my being believes that, because why else? Why else would you go against trying to get rid of chronic disease? Why else would you go against trying to make agriculture and habitat, less toxic and more productive for nutritious foods, etc.? Okay. The last bullet point. Removing toxins from the environment. One of MAHA's top priorities is the elimination of harmful chemicals and toxins from, excuse me, from America's food, water, and air. MAHA advocates for comprehensive testing and monitoring of environmental toxins to ensure that all Americans have access to clean, safe, and healthy living conditions. That, excuse me, that's the nuts and bolts of MAHA. Now, when you hear that, is there really a part of your brain that says, there's something insidious to that? They must be up to something. There's got to be something evil behind that. It flabbergasts me that anybody might actually go that direction. Now, the two things that go, I'm not going to say go against, but the two things that the legacy media want to always bring up as negatives towards Bobby Kennedy. The first, of course, is vaccines. We're going to be talking a lot about vaccines. It's going to happen over and over again on this show. We will talk about it. There's lots and lots and lots to talk about with vaccines. But probably the biggest thing, and the thing to talk about right here and right now, is just that as far as the legacy media is concerned, you cannot talk against vaccines. If you say anything that even remotely puts down or questions, that's the big thing, questions vaccine validity, vaccine safety, the history of vaccines, any of that type of thing, you are immediately branded a pariah. You are immediately branded public enemy number one, and you are attacked. You are shut down. Your accounts, okay? I just watched last night the Joe Rogan interview with Zuckerberg. Let me say two things about that. Number one, I will give Zuckerberg the benefit of the doubt when he talks about how difficult these algorithms are when it comes to deciphering what is misinformation and dangerous versus what's not, and that confusion can happen. And because of the size of this, that mistakes can happen. No problem. I'll give you that. Okay. I'll take a little check mark next to your name for a positive. Got that. Okay. I also will give you that, the government was the ones coming after you and yelling at you and saying, we're threatening you. You need to do these things. I get that too. Okay. The problem I have with that Joe Rogan interview was that Zuckerberg never really stepped up and said, you know what? Even though the government was breathing down our necks, even though they were threatening us, they were making demands, I made a mistake. I made a mistake. I should not have kowtowed to the government and done these things that we did. We censored people. We destroyed livelihoods. There were people making lots of money off of their followings from these social media that had their accounts removed and they lost money. Are they going to repay those people? He never even talked about the people that they deplatformed. He never even talked about putting those people back and giving them all their followers back, because I'm sure it's still there in their files, all the people that were following them. He never talked about that. And that to me was the biggest negative of that conversation that I watched with Joe Rogan. I love Joe Rogan. I think he's an amazing interviewer. He seems like an amazing guy. Um, I wish he had pushed just a little bit in that direction when Zuckerberg, skirted those issues. So I'm glad that Mark Zuckerberg is trying to redeem himself. I'm glad that he's making moves to remove the censorship that he was part of. I just wish that interview would have been more, him owning up to his part of that. So I just digressed. I will come back onto target here. That censorship, that control of media, which happened across all platforms. YouTube was a big part of that. At the time, X, before Elon Musk purchased it, was a big part of that. And of course, the legacy media was the biggest part of that. Anytime you mention vaccines, you are a bad guy. And so they look at Bobby Kennedy with that lens. They say, okay, well, since he's brazen enough to speak out strongly about vaccines, then we have to shut him down. And they try. They have tried so hard. And I will tell you something, Bobby Kennedy is such a strong individual when it comes to how he handles things. I mean, he is amazing. I don't know of anybody who can take the amount of abuse that he has taken and come out of it with such an amazing attitude. So let me say, I'm not best friends with Bobby Kennedy. I would love to be. He seems like he's such an amazing guy. I have met Bobby. Bobby and I have met, and I'm calling him Bobby only because he always tells everybody all the time to call him Bobby. Bobby Kennedy is to me one of the most amazing individuals. This picture here was taken from a health freedom event that he spoke at, where I got to meet him. Very, very, very nice guy. One of the smartest guys I think I've ever met. I mean, he can rattle off statistics and facts like it's nothing. He's got a mind like a steel trap. He remembers all of the details, all the minutia. I wish I had that mind. I consider myself a pretty smart guy, but coming up with the exact figures and exact numbers for data, I have to write that stuff down. I have to look it up. Even stuff that I've studied for 20, 30, 40 years, I still have to look stuff up and get the exact figures down. He just has that stuff nailed. It is amazing. I've had the honor and the privilege of meeting him a couple of times. It's not like we sat down and had dinner and a beer. Bobby, if you're out there, I would sit down and have a beer with you anytime and have some healthy food with you. I don't know if he even drinks. He doesn't drink alcohol. He's a recovering. So how about some iced tea? But he's a great guy. And so, with all information up front about Bobby, I think he's an amazing individual. I've been following his career and listening to him for well over 20 years for sure. But I got into the health freedom movement a long time ago, late 90s, early 2000s is really when I started becoming more into that movement. And Kennedy really didn't get into it more until, I don't know exactly when, 2005, 2008, somewhere around there. But I've always respected what he has had to say in regards to pretty much anything. I think he does a really good job of fact checking anything he's going to say before he opens his mouth. As a lawyer, he knows that he could get sued for libel, that he could get brought to task for something that's not accurate. And even though the media likes to bring him to task for some of the things he says, I will tell you this, he can back it up but the media will not allow him to back it up. The media will not allow him to do what he needs to do to back it up. Trump, hopefully, is going to put that in action. And that scares the bejeebers out of the people in charge, scares them to death. Oh my God, they're so scared of Bobby running the NIH because they know that he's not full of it. They know that the corruption is there like he says it is. So that's something that has shocked me with people sometimes is when we talk about the corruption at the FDA, when we talk about the corruption at the CDC, talk about the corruption at the NIH and at the World Health Organization, if we want to even go outside, the amount of corruption, the amount of conflicts of interest, my God, is ginormous. Some of you may already know that I have written a book. It is not published yet. We're in the process of getting that taken care of. One of the chapters is on conflicts of interest, and in that I go over information about conflicts of interest in the FDA, the CDC, et cetera, et cetera. It is stunning to me when people want to believe what they're telling you and that what someone else like myself is saying right now must be a conspiracy theory. It must be a conspiracy theory. The one thing you should have learned already by this point about conspiracy theories is that they're not always conspiracy theories, or if that conspiracy theory is true. So yes, there's tons of things that may not be true, but I will tell you when it comes to the past 5 years or so, especially under the pandemic, you've got to be able to open your eyes and see, yeah, all these things that they were calling conspiracy theories, these people they were shutting down, it turns out they were correct. They were right. Oh my God. There's so much that has been proven correct that people like myself and others with the like mind were yelling at, saying, you know, hey, this is what this is. And we were being said, no, you're a crazy conspiracist, and being shut down. And it turns out that not so crazy after all. So let's talk a little bit about those goals from MAHA. One of those, and to me, the most important one, and I say to me because it's really goes into the topics that I started following Bobby Kennedy for, and that was the whole chronic disease information. Oh, by the way, do you like my plant? After that last episode, I'm like, we got to put something in the background. Got to mix it up a little bit, make it a little bit nicer. So lighting is hopefully a little bit better. We got the plant. We're going to improve that as we go, but focus on the words. So let's look at some chronic disease information. I forgot to pull this up, and I should have pulled it up, and I'm not going to spend the time looking for it right now. But when Kennedy first started saying, hey, chronic disease epidemic, MAHA is focused on this, the legacy media, there was an article that came out. I want to say it was in Time magazine, but I don't know that for sure, so don't quote me on that. But it basically questioned this whole idea that there was a chronic disease epidemic. It made it out to seem like, oh, Kennedy, he's barking up the wrong tree. We don't have this chronic disease epidemic. It's not so bad. Don't freak out, everybody. Don't panic. It's really not a big deal. Once again, the interests that don't want things to change control the media. They can argue all they want about that, but when you think about the advertising dollars that go into legacy media, when you think about the percentage of commercials and ads that are pharmaceutical, there's no denying the control that industry has on the media. And to say otherwise is just closing your eyes and being ignorant to it. Okay, there's no denying it. There's definitely control. And liberal politics may be a part of that. I don't know. I'm not a liberal. I'm not a conservative. I consider myself a little bit more libertarian, kind of in the middle. There's many things on the Democratic liberal side of things that I agree with and that I support. And there's things on the other side that I agree with and support. So I'm not trying to get into a liberals versus conservatives, Republicans versus Democrats. We've got way too much of that crap as it is. what I want to do is just look at some of the facts and look at MAHA as something that is so important to our nation. Our nation is in a downward spiral in some ways. It's a great nation still. We have lots of strengths, but we also have a problem in multiple areas. But when it comes to the health of our citizens and even the health of our children, how people can't get behind that and put aside their political leanings is sad. So let me do a little fact checking for you, and let's talk about chronic disease. So I'm going to pull up something else here again. I have to first make it show up here. We are experiencing technical difficulties. Please stand by. All right. Okay, so here we go. Sharing the screen now. So this first thing I'm sharing here, there we go. This is this is from a group called Partnership to Fight Chronic Disease. I took this from their website, and as you can see, they've got everything documented here. They're giving you quotes and information. And so some of the stuff that I'm going to be reading off here is a repeat, but I wanted to kind of show you that it goes across a bunch of different time periods, as well as different people talking about this. So chronic disease costing lives, reducing quality of life. 45% of the population have at least one chronic disease. 45%. Now you're going to hear some other research papers that were written that actually it's going to be higher than that. Okay. Chronic diseases are responsible for 7 out of every 10 deaths in the United States. Chronic disease, 7 out of every 10, 70% of deaths in the United States are from chronic disease, killing more than 1.7 Americans every single year. That sounds pretty bad to me. Yeah. I don't know why anybody else can't see that as pretty bad. Chronic diseases, increasing demand for healthcare and driving up costs. People with chronic conditions are the most frequent users of healthcare in the United States. They account for 81% of hospital admissions, 91% of all prescriptions filled, and 76% of physician visits. So let's talk about motivations. If I'm the pharmaceutical companies and 91% of all the prescriptions that are filled are from people with chronic disease, do I really have a motivation to do anything to support the removal of chronic disease in the United States? I'll let you think about that for a second. Do you really think that the pharmaceutical companies, that their motivations are all about, we're just in this to help people. We're just in this to create health and to make sure that everybody has a good quality of life? Oh, come on. Another chapter in my book that's coming out has to do with these corporations and their lack of liability for vaccines. And when you look at their history should tell you directly that they should not be trusted with a product that has no liability. There's no trust at all for these companies if they don't have liability. None. Because even the products that they have liability for, they still lie. They still lie and cheat, and there's tons of lawsuits where they have had to pay millions and millions, if not billions of dollars because of products that they have liability for. Now think of a product with no liability. Do you think they're going to be honest about that? Come on. Wake up. I mean, seriously, there's no way. So when we think about who is it that might be fighting against MAHA, who is it that might be behind demonizing Bobby Kennedy? Well, I can't tell you for sure who. I can tell you who has one of the biggest motives. Pharmaceutical companies. They have a huge motive. Huge motive. 91% of prescriptions filled chronic disease. Why should we help anybody get rid of chronic disease? Is that speculation? Sure. I think that's educated speculation, though. I think that makes a lot of sense. I don't know. Chronic diseases also account for the vast majority of health spending. In the United States, total spending on public and private health care amounted to approximately $2 trillion. $2 trillion. Of that amount, more than 75% of that 2 trillion went toward the treatment of chronic diseases. One of the things that Bobby has spoken of over and over again is how much this epidemic is costing us, not just in lives, not just in quality of life. Those things are beyond understanding. They're so huge, but in the amount of money that it's costing the American government, how much money is part of our national debt because of chronic disease. And that the goal of removing chronic disease not only will make people's lives healthier, make people have a better quality of life, etc., change the future for our children, but it can help bring our nation out of debt and put us back on economic footing that is strong and secure, not where it is now. Continuing with that, healthcare coverage costs 5 times higher than for those without such conditions. So people who have chronic conditions, their healthcare average costs are 5 times higher. If you have a chronic disease condition, your healthcare costs are 5 times higher. Total cost of obesity, which is just one of a multitude of chronic disease problems, to U.S. companies is estimated at $13 billion annually. It's stunning to me. It really is stunning to me. So that's just one. Let's look at another here. I'm not going to click that one out of there. So this was a article written in the International Journal of Environmental Research and Public Health. This was done in 2018. Okay, so a little bit a ways back there. I'm going to scroll down. It was called An Empirical Study of Chronic Disease in the United States, a Visual Analytics Approach to Public Health. So here, and this was 2018, nearly half of Americans, 45%, suffer from at least one chronic condition. And the number is growing, and that is 100% true. It is growing steadily. According to the Centers for Disease Control, in the United States alone, chronic disease accounts for nearly 75% of aggregate healthcare spending. In terms of public insurance, treatment of chronic diseases comprises an even larger portion of spending, 96 cents per dollar for Medicare, 83 cents per dollar for Medicaid. So almost all of the money being spent for Medicare and Medicaid are on chronic disease. More than 2/3 of all deaths are caused by one or more of these 5 chronic diseases: heart disease, cancer, stroke, chronic obstructive pulmonary disease, and diabetes. Additional statistics are quite stark. Chronic diseases are responsible for 7 out of 10 deaths in the United States. I just mentioned that before, killing more than 1.7 million Americans each year, and more than 75% of the $2 trillion spent on public and private healthcare in 2005 went towards chronic diseases. I think that's all I highlighted in this one. A lot of information in this one. It's a very long read. All right, this one here, this one is from ACR Open Rheumatology. This was 2020. So I'm trying to show these to you as the time progresses, getting up closer to where we are here. The relation of the chronic disease epidemic to the healthcare crisis. Come down to my highlights here. In the last 20 years, the prevalence of chronic disease in the United States has grown by a steady 7 to 8 million people every 5 years. 7 to 8 million people every 5 years having chronic disease. Think about that. Let's use that $8 million mark. $8 million, 8 million people, 8 million people mark. 8 million people every 5 years, it's going up. 8 million people. That is an enormous growth or increase in chronic disease among our population. Every 5 years, another 8 million people, another 8 million people. That's insane. Today, chronic disease affects 50% of the population. So remember, before it was in the 40s. Now we're already up to 50 here. And its care consumes more than 85% of healthcare costs. It has become an epidemic, quote, okay? So the authors of this paper go right out there on the limb and say, this is an epidemic. Yeah, and Bobby's insane, right? Crazy, crazy stuff. Now, this article continues and it starts talking about, as it states here, the abdication by medical education, meaning how has medical education, that Western medical model, where chronic disease is the epicenter, okay, how have they failed? What are the shortcomings of that part? Shortcomings of medical education were revealed by two studies from the Johns Hopkins School of Medicine. In 2001, a random sample of all U.S. physicians who practice at least 20 hours weekly were questioned about their training for care of patients with chronic disease. They reported that their training had not prepared them to, number one, educate patients with chronic disease, number two, coordinate in-home and community services, number three, provide end-of-life care, number four, manage geriatric syndromes, number five, manage psychological and social aspects of chronic care. Yeah. I don't see a six there. Okay. But anyway, assess caregiver and family needs, etc. So their education did not prepare them for any of these aspects of what the chronic disease epidemic consists of. And you could say, well, this has been changing ongoing and that it's hard for schools to keep up with this kind of thing. The chronic disease epidemic has been going on now for quite a while, and it's been accelerating and increasing exponentially. This is something that the medical profession, the Western medical system, should have a tight grasp of. It shouldn't be something that is, oh, really? This is going on? No, it should be something that they understand wholeheartedly. And as such, they should be looking forward in that and saying, this is increasing and we're probably not going to stop this tomorrow or the next day or the next day or the next year. So we need to prepare our medical doctors to be able to handle these situations to the absolute best that we can. And the medical systems, the medical schools should be taking care of that. And according to this study, they're not. Academic medicine's low concern, their words, not mine, for chronic disease or the role of the patient with chronic disease was reflected in the agenda items of their meetings or the section headings of their reports. For 6 broad health policy meetings between 2000 and 2001, and for the Association of American Medical Colleges annual meetings in 96 to 2001, the words chronic disease or patient role appeared only 10 times. In 262 agenda items or section headings, it only shows up 10 times. And for the American Medical of Colleges, they appeared twice in 150 items in 6 agendas. That does show a lack of concern. That shows a lack of concern. It shows either a denial or a lack of concern of the problem that exists in chronic disease in this epidemic. I think that I find that pretty stark. But most are not new. Most are generalizations without implementation plans. Even when addressing high need, high cost chronic disease patients, there is little mention of the chronic disease epidemic, of the needed change in the practice of medicine, or the role of the patient. Once again, this is still talking about medicine's lack of concern. Now, once again, that lack of concern, that's what these authors are saying. It's not my words, it's theirs. You can sue them, not sue me. And in their conclusions, the fundamental responsibility of the medical profession is to create a healthcare system and a practice of medicine that meets the needs of current illnesses and patients. The profession has not done so. The forces that block it are not blind forces. They are decisions made by people, primarily the leadership. The decisions can be analyzed and reversed, and the decision makers can be held accountable. And until that occurs, the profession cannot meet its fundamental responsibility. When will we awaken? Pretty powerful words. And this was Halstead R. Holman. I don't know his background. but that could be looked up. Maybe it's at the bottom here. Dr. Holman drafted the article, revised it. It doesn't say who he is, but very powerful. Okay. So that's another one. And this one, I chose this one because it not only talked about the chronic disease and those facts and figures that we're talking about, but really brought home this idea that, you know, there's kind of a denial of this and an ignoring of this. And that's just leading to more and more and more problems. All right, the last article I have here, this one was 2024. So here we are. This is just last year. The Burden of Chronic Disease by Karen Hacker. This was Mayo Clinic Proceedings in their journal here. So what does she have to say? Chronic diseases remain 8 of the 10 leading causes of death in the United States. So 8 out of 10 of the leading causes come from chronic diseases. The cost of chronic diseases to American medical system is enormous, accounting for more than $1 trillion every single year. Chronic disease accounts for the overwhelming percentage of preventable deaths and disabilities in the United States and around the world. According to the World Health Organization, 63% of worldwide deaths in 2008 were caused by major preventable diseases. In 2011, the cost of chronic disease worldwide was estimated to reach 47 trillion by 2030. 47 trillion. Crazy numbers. Crazy numbers. I'll go down a little bit here. I got one more little piece here highlighted, I do believe. Oh, I thought I did. That was it. All right. I'm going to get out of that there. Okay. So the reason I did it like that is I want the viewer to see and hear, not from my words, but from the words of these researchers and journals, that the chronic epidemic of the epidemic of chronic disease in America is real, and it's devastating. And the majority of what they're talking about there in a lot of those statistics have to do with those top 10 leading chronic diseases that are responsible for death. They're not even really talking about the chronic diseases that may not cause any kind of death in a immediate type of way, you know, like heart disease killing someone pretty quickly, or you know, something like that. Think about the chronic diseases that are ongoing, that people have to live with for their entire life. Okay. We talked about vaccines earlier. How about autism? Okay. Autism is a chronic disease. It's something that is lifelong, and it's very difficult to do anything about it. Now, autism is very different than some of these chronic diseases. A lot of the chronic diseases are occurring from lifestyle, you know, obesity, diabetes to a certain degree, heart disease to a certain degree. A lot of these, you know, arthritis is a chronic condition. Some of these things can be changed fairly quickly, fairly completely with lifestyle changes. There are a lot of lifestyle changes that could change those things pretty dramatically. So there's a big variance between the different types of chronic diseases that you can talk about. And most of what's being talked about in these articles are, like I said, those top 10 leading deaths, the things that cause death. So the other aspect to consider is, once again, that, you know, chronic disease doesn't just kill you. Chronic disease can just debilitate you for lifetime. And not only is that affecting the person with that chronic disease, but it's affecting the caregivers. It's affecting the people that have to is probably not the best word, but the people who care for these people, who love these people, the families. There's devastation that occurs here. Homelessness. There's people that are homeless, you know, because of medical conditions that they could not pay for, that took away everything. I'm not saying that's the vast majority of homelessness. I'm not even trying to get into the topic of homelessness. I probably should have opened that can of worms, but I'm just trying to illustrate the devastation that occurs with this. So when we talk about MAHA, that number one thing, that number one issue is chronic disease. I'm typing in something here. Well, I couldn't find it right off the bat, so I'm not going to bother with it. But, you know, another aspect of chronic disease. So, you know, I think, I think that a lot of these media slams and these efforts to demonize Bobby, almost every single thing comes back to vaccines. Vaccines are a very interesting topic. I don't know of any, let's understand something very clear. Vaccines are a pharmaceutical product. I don't care how it's categorized, they're a pharmaceutical product. Name me one pharmaceutical product that you cannot question. There's only one, and that's vaccines. If I were to question statins, or I were to question immunosuppressant drugs like for rheumatoid arthritis or something like that, nobody would get so upset. They may disagree with you. They may tell you that your information is limited and let's talk about this. Let's debate about it. Let's find out where the discrepancy is in your understanding and what they think is reality. Okay. That may be the case, but to totally shut you down and refuse to have any real conversation about the pharmaceutical product, that does not happen. There's only one pharmaceutical product where that happens, and that's vaccines. You try to talk about vaccines, you try to show evidence that may hurt the reputation of vaccines, and oh my God, you are beset upon by all these people. And that is actually, I think, the core of what's happening with Bobby Kennedy. He dared to put up a fight against their holy product. Okay. There is almost a religious fervor surrounding the topic of vaccines. People do not like it when you talk bad about them. Here's the thing. Bobby is ready at any moment to sit down and discuss the facts if you're willing to listen. But you have to be willing to listen. And one of the facts when it comes to vaccines is that the degree of safety testing for these pharmaceutical products is not the same as it is for other pharmaceutical products. That's a fact. That's not an opinion. That's not someone trying to slander. Okay, that's a fact. It shows up in the documents for the studies of these vaccines. And one of the biggest things that Bobby has always discussed in his conversations regarding vaccines, and I have listened to these conversations for a long time now, so I can tell you with personal experience from facts from my own ears, from what he has said and what he has written, that it's not a matter of saying we need to get rid of all vaccines. That's what the people who are running scared want you to believe. They want you to believe that Bobby Kennedy is trying to get rid of all the vaccines so that your children are going to die. There was actually a political figure. I can't remember who it was, a senator. I saw a clip of him on X, on Twitter. Okay. And he actually made this statement that what basically RFK Jr. was doing was going to lead to the deaths of children. That is libel. That is something that I wish he would be sued for. I wish that Bobby would step out and say, F you, you're going to court and you're going down for making these types of statements. It's ridiculous. It's hyperbolic and it's ridiculous. He's not wanting to take away all the vaccines. What he wants to do is hold the pharmaceutical companies liable for what happens with their products. Remember, if you don't know this, pharmaceutical companies in 1986 were given liability free. All liability for these products goes over to the government, not on the pharmaceutical products themselves. He wants liability, and he wants these companies to step up and do the right thing and do the studies the right way so that we know without question, without debate, we know what is going on with vaccines. And those studies do not exist. Those who want to argue that they do are not doing the deep dive and the due diligence of really looking into this topic. They're not, because it really doesn't take a whole lot of effort to find this information. If you just go to the CDC's website, if you just go to the pharmaceutical websites, they're going to tell you what they want you to hear. And what they want you to hear is relax, calm down. Vaccines are okay. They're safe. They don't cause autism. Every study has shown that they don't cause autism. These people who say they do cause autism don't know what they're talking about. Now, that's a totally separate topic. We'll talk about that later too. But I want to show you a recording. So we're going to listen to a recording. Aaron Siri, you can follow him on X. I do. He's an amazing individual. Does a lot of work for the Children's Health Defense, which is Kennedy's organization. He does work through ICANN, is the primary thing that he works for. ICANN is Informed Consent Action Network. The High Wire, which is an amazing show to watch. I recommend that highly to anybody, thehighwire.com. He does a lot of work through ICANN, and they have sued the government and they have done depositions. So what I'm going to show you here is actually footage from a deposition that he did with, I don't think this clip is with Stanley Plotkin. This is with the other author of this vaccine book. I forget her name. You're going to see it in a minute. Stanley Plotkin, who is considered like the father of vaccinology. He's written one of he's one of the co-authors of a vaccine book that is the pharmaceutical companies and the medical schools use this book to teach out of. This is something that they teach out of. He is considered one of the big time researchers for vaccines, proponents for vaccines, written one of the major books for the education of medical doctors for vaccines. So this guy is vaccines. He is the expert. Aaron Siri deposed him and the co-author, I forget the woman's name, you'll see her in a minute, because there was a lawsuit that had to do with autisms and vaccines, and he deposed them, meaning they are under oath on camera talking about vaccines. So this is from a Russell Brand interview with Aaron Siri, where he shows the video.
Involved vaccines and autism. And do you remember that the medical textbook on vaccines you saw on the screen earlier, Plotkin's Vaccines? Dr. Catherine Edwards was one of the 4 listed authors. She's one of the world's leading vaccinologists in the world, coming into a deposition with me, knowing about the claim vaccines cause autism. That was the central issue in the case. And so she knows I'm going to ask her about it. So presumably she comes prepared. She's coming prepared for my questions about vaccines and autism and all the vaccines, because all the vaccines were at issue. All the vaccines given in the first 6 months of life were at issue in that case too. So let's see what Dr. Edwards has to say with regards to the state of the science with vaccines and autism, literally out of the mouth from the world's leading vaccinologists. And let me see if
conducting clinical trials.
Okay. According to your profile, you have done most of the pivotal trials relied upon to license many of the vaccines, correct, on the market?
Yes, sir.
Okay. So you're highly experienced in conducting clinical trials, correct?
I'm highly experienced conducting clinical trials.
And you're familiar with many of the clinical trials that relied upon to license many of the vaccines currently on the market, correct?
I am.
In your opinion, Did the clinical trials relied upon some licensed vaccines that Yates received, many of which are still on the market today? Were they designed to rule out that the vaccine causes autism?
No. You badgered me into answering the question the way you want me to, but I think that that's probably the answer.
Is that your accurate and truthful testimony?
Yes.
In the expert disclosures for this case, it asserts that, among other things, you will testify that, quote, the issue of whether vaccines cause autism has been thoroughly researched and rejected, end quote. It's your testimony that MMR vaccine cannot cause autism.
That's correct.
It's your testimony that Hep B vaccine cannot cause autism.
That's correct.
It's your testimony that iPol cannot cause autism.
Yes.
It's your testimony that Hib vaccine cannot cause autism.
Yes.
Your testimony that varicella vaccine cannot cause autism.
Yes.
It's your testimony that Prevnar vaccine cannot cause autism.
Yes.
It's your testimony that DTaP vaccine cannot cause autism.
Yes.
And do you have a study that supports that DTaP doesn't cause autism?
I do not have a study that DTaP caused autism, so I don't have either.
Do you have any study one way or another of whether iPol causes autism?
No, I do not, sir.
Do you have any study one way or another of whether NGRX B causes autism?
I do not have any evidence that it causes autism, nor that it does not.
And what about Hib titers vaccine? Any evidence one way or another whether it causes autism? No. And what about Prevnar vaccine? Any evidence one way or another?
No, sir. No, sir.
And how about varicella vaccine? Let me just finish. Are there any studies one way or another that, or whether it does or doesn't cause autism?
Part of MMR, but not as varicella by itself. No, sir. No studies that say it does, or no studies that say it doesn't.
There have been studies that have found an association between hepatitis B vaccine and autism, correct?
Not studies that I feel are credible.
Okay. Which study are you referring to when you say that?
Well, why don't you show me the study and then I'll see whether I agree with it.
That's amazing.
Oh my God. I can't watch that without laughing. Look at that woman's face. If there's ever a time when a lawyer should be able to say, should I be able to treat this person as hostile, a hostile witness? This is definitely the case. Her face, she just wants to, if she had a gun, she would murder Aaron Siri right there and then. She is so incensed that she has to sit in front of this camera and be forced to tell the truth. Oh my God. And if you didn't catch what she was saying, I'm just going to kind of summarize. Aaron Siri was asking her, is there a study that actually shows that these vaccines do not cause autism? Do not cause autism. The thing that they say all the time, like it's a fact, vaccines do not cause autism. And for every single one of those vaccines, she said, no, there is no study that shows that they do not cause autism. Now, her defense is that, well, there's no study that I accept as good that says they cause autism either. So wait a minute. There is no study that you've done, that the system has done, that she's part of, that proves that vaccines don't cause autism. Yet, there are a multitude of studies that show correlation, but you deem that they're not acceptable. Wait a minute. A bunch of them that show correlation that you deem not acceptable, but there's nothing that's been done that shows that they don't. Yet, the public discourse is they don't cause autism, period. And the mainstream media, this is the part that really just pisses me off. The mainstream media, if I was on the mainstream media and I made this comment, I would have someone from ABC or MSNBC across from me going, no, 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 they've been proven. It's been proven that vaccines don't cause autism. No, 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 you're wrong. You're wrong. Stop saying that. Stop saying that. Stop saying stuff bad about vaccines. You're wrong. It's been proven. Where the hell are they getting that information? Really? No, it hasn't been proven. Now, the reason I showed you that is not to segue off into autism. We'll save that for another day. I showed that to you to show you how ridiculous it is to demonize Bobby Kennedy for the things that he says. What I showed you with that little video is a very, very small piece of the information that supports a question mark, a very big question mark regarding the safety of vaccines. And who really should be arguing that? Shouldn't we all want vaccines to be safety tested and improve the product so that we don't have people getting autism or chronic diseases or dying? I mean, really, seriously, why would anybody argue that? The only thing that Kennedy's trying to do is that he's trying to get the corruption out of the system so that we don't have, once again, people paying for science that says what they want it to say, skipping the actual trials that need to be done, doing research the way that it should be done. None of that should be unreasonable to anybody, but he gets demonized for it. So I just want you to hear that. I want you to think about that. Okay. Think about that. Think about the motivations. Where does that come from? Okay. There's that old expression of follow the money, right? Follow the money. Who has the most to lose in this situation? Okay. We're talking about trying to do something to save the children of this country, to save Americans in general from falling down the rabbit hole of chronic disease. And everyone should be on board with that. Everyone. Let's look at something else. Let's get outside of this vaccine topic here and get into something else here. Okay. We're going to come back over here and I'm going to get rid of this top thing here. All right. So let's get rid of that. So here, I don't know if you've heard of Food Babe. I honestly had never heard of her until MAHA started bringing in people from different perspectives to talk about nutrition. This woman, I don't even remember her name. I apologize. All I think of is Food Babe. What is her name here? Vani Hari. She wrote a book, Food Babe, etc. But the reason I wanted to show this is not to promote her necessarily, nothing against her at all, whatever. I don't know anything about her really. Is that she's got these clips on her website that you may or may not have seen before. And these are talking about the difference between products that we see here in the United States and products that we see in other countries. And the reason why this is something that's worth seeing is because it brings up a really good point. Why are products made in America a certain way and then made in another country in an entirely different way? And let me rephrase that. Why are products made in an incredibly unhealthy way in the United States? They're allowed to do so. Yet these same companies with these same products produce them in a healthier way in another country. This is something that should totally piss you off as an American. You should be like, wait a minute, you're feeding me crap? You're feeding me products that are going to lead to me getting chronic disease and ill health when you're doing that same exact product in a healthy way somewhere else? Why don't you just do it in a healthy way here? What the hell's the problem? Make it in a healthy way here to begin with and not make me have to fight for this. Why should I have to fight for you as a company to be concerned about my health instead of you as a company concerned about your frickin' bottom line? And that's pretty much all it is. So this is McDonald's fries in the United States versus McDonald's fries in the UK. Look at that. Look at the size. it's half of that. Okay. Potatoes, the French fries in McDonald's fries. This is probably what, if you're anywhere close to, my age group when we were first having McDonald's, because man, I tell you what, junior high school, into high school, McDonald's was the bomb, man. That was the place. That's where we hung out, back in Texas where I grew up, McDonald's was the place, on the weekends. That's where everybody gathered, was McDonald's, and the fries were probably made just like this here on that right side back then. But over the years, they've been adulterated into this garbage that we see here on the left. Look at that on the right, potatoes, vegetable oil, and that vegetable oil is actually sunflower and rapeseed oil. Rapeseed or rapeseed oil is actually a healthier oil comparatively. Okay, we'll get into seed oils and stuff in a different topic. There's a lot to talk about there. There's definitely some truth that there's some bad stuff, and there's probably a little bit of exaggeration with some of it as well. So there's probably a good conversation to have when it comes to seed oils. We'll talk about that some other time. Dextrose, which is a type of sugar, fried and non-hydrogenated vegetable oil, and then salt is added after the cooking. Okay, so almost nothing. It's almost like potatoes and vegetables and oil, and that's it. Okay. Over here, we got vegetable oil, and look at the ones that are used here, including hydrogenated soybean oil. That's hydrogenated. We're talking about hydrogenated oils. These are the bad things, the trans fats. Dextrose, sodium acid pyrophosphate, salt, fried and vegetable oil blend with citric acid and dimethyl, blah, 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 whatever that is, okay? Once again, a different product. Let's look down here at Quaker Instant Oatmeal Packets. Now, these few things that are shown here on her website are not the only things. This is just a very small sampling of what you can find out there. So once again, look at that list difference. Oh my God. On the right, Quaker whole grain rolled oats with sugar, freeze-dried raspberry pieces, freeze-dried strawberry pieces, and natural flavoring. Now look over here. Whole grain rolled oats, sugar, creaming agent, bunch of stuff there, flavored and colored fruit pieces, artificial strawberry flavors, red dye number 40, okay, guar gum, artificial color, blah, 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 blah. Look at all the stuff they add to this, okay? What the heck? Mountain Dew. How can they screw up Mountain Dew? It's already a bad product anyway, right? But look at what we're looking at here. Once again, okay, look at here when we talk about coloring. Over here in the UK, yeah, this is UK. Over here in the UK, look at that. The coloring is made from beta carotene. Beta carotene, something that you can use for coloring that's healthy, okay? But over here, we've got yellow 5, okay? That's their coloring. They use that synthetic dye, these dyes that may have, cancer-causing agents in them, okay? High fructose corn syrup, sugar, big difference, right? A lot of people understand the difference between Coke and Mexican Coke, right? If you ever go and you want a Coke somewhere and you can get a Mexican Coke versus Coke, people who really like Coca-Cola, they get the Mexican Coke because the Mexican Coke has sugar in it, not high fructose corn syrup. It doesn't have some of the crap in it that the American version has, and it tastes totally different. Now, myself, I haven't had a soda in 40 years, maybe. I mean, it's been a long time. I can't even remember the last time I even tasted a soda. So I'm not a soda person, but I know people who are soda people, especially when it comes to that Mexican Coke difference. And that's kind of what we're talking about here, Here we have Heinz ketchup. Once again, look at the difference in that. Okay. Onion flavors, spices, natural flavoring, corn syrup. That's probably high fructose corn syrup and corn syrup. Okay. And of course, just sugar over here, right? So big difference, big difference. Doritos. Okay. Oh, if you like Doritos, I guess more power to you. God, I can't fathom putting that kind of stuff into my body. I'm not a perfect health specimen, nor do I make every decision the right decision, but there are some things that I just refuse to put into my body, and this is one of those kinds of things. So still, look at this. It's a huge, even the good version has monosodium glutamate. That's MSG. I don't care what the scientists that are paid for by the food industry want to say good about MSG. There's lots of people who have allergies to MSG. So Lots of people. But look at all of that. Okay. Look at all the, okay. For the coloring, they use annatto. Once again, annatto is a more natural way to color things. Over here, we've got artificial red 40, blue 1, and yellow 5. I mean, I don't get it. Okay. Here we have frosted flakes. Once again, look at the difference in what we have there. They actually use BHT in there, which is something that's been known to cause problems in people. I mean, it's on the record scientifically. So there's a lot of that out there, a lot of that. And so you have to ask yourself, why? Why are the companies allowed in America to put all of this crap into their products? They had on a big meeting with MAHA individuals, with members of Congress, they brought up, I want to say it was Fruit Loops in Canada versus Fruit Loops in the United States. And they poured them out into a bowl to show you what they looked like. The ones from the United States, if you'd turned the lights off, they could have glowed in the dark. The ones from Canada, not nearly the type of coloring, the brightness, kind of look dead compared to the ones. And like, well, American children want these to look like this. Really, are we letting American children decide what's going into their systems? I mean, the parents should be the ones deciding, but then the parents can only decide from what's given to them by the companies. And so let's stop with the blaming of the children and saying the children want this, please, whatever. Number one, it's not up to the children, it's up to the parents. And the parents have to decide based on what's given to them by the companies. Companies need to be giving parents better selections, and then the parents have to make better choices at that point. But that's another topic also. I'm going to show you one more thing here. All right, let's get rid of this again. Okay, so this is a paper, HHS Public Access, Human Health Services is what HHS stands for. This is 2019. How does the healthfulness of the U.S. food supply compare to international guidelines for marketing to children and adolescents? Because I showed you that one that shows you the difference between what products look like in America versus, the UK, and that's only one example, I thought I would show you this study here as well. Let me move down to my highlighted pieces. There it is. Okay. This is the first study to examine what proportion of products in the U.S. food supply would be eligible for marketing to children under the World Health Organization's NPM and the Chilean schemes. Now, those two things are basically programs that were set up by those individuals to try to make better health choices available marketing wise towards parents. We found that the vast majority of US packaged food and beverage products were ineligible to be marketed to children under both of those schemes, with 21% eligible using the WHO criteria, only 21. Okay, so almost 80% of the United States products would not qualify under the WHO's criteria for promotional of healthy products, and only 26% under the Chilean criteria. This highlights that products being purchased by U.S. households with children are of low nutritional quality by international standards. And let me preface that by saying this doesn't mean that the international standards are perfect. Okay, this is just comparing them to those international standards. The international standards are so much better than the American standard that 80% of the products that they tested or looked at would not qualify to be able to be promoted by these systems. The most recent Federal Trade Commission reported that out of 44 major food and beverage companies, $1.79 billion was spent to market their products to children and teens in 2009, with carbonated beverages, confectionery, and snack foods representing the three top food categories with food advertising directed at teenagers. Well, my kids want this. I wonder why. I wonder why they want this, because they're being marketed to directly with these crap products that even the international standards say 80% of them will not qualify for that. Okay. So, once again, anybody who is arguing against MAHA, anyone who is arguing against Bobby Kennedy getting in control of the NIH to create changes, in my opinion, it's because they are bought and paid for by the companies and the individuals who want to stay in power, and they don't want to see this stuff change. If you, as an American, if you, as a parent, want a reduction in chronic disease, hey, hell, let's go even further. Let's say an elimination of chronic disease, if we could even get that far. If you want safe vaccines, Bobby Kennedy is not trying to take away all your vaccines. If you want to continue doing vaccines, he wants those vaccines to be safe for you. He wants you to have a choice too. He doesn't want it to be forced into you or your child. He wants it to be a choice, and he wants those choices to be based on good science so that you have healthy products. Who would argue that? Only an insane person would argue against that. It'd be crazy to argue against that. If you want safe vaccines, if you want corruption taken out of the agencies so that what you're getting is health that is directed for you, towards you, to make America a healthy place again. That's what the MAHA movement's all about. That's what Bobby Kennedy is all about. You know, the information that I've shared with you, I hope some of it, I really hope, was an eye-opener, an awakening, because it's stuff that you have to be aware of so that we can make the changes that are necessary. And, you know, RFK Jr., Bobby, okay, he's the man. He is the man to do this. If there's anyone who has the brain power and has the tools necessary to make these changes happen, it's him. There is no one else that I can see that has the tools necessary to make these changes other than Bobby Kennedy. He is he's the man. He's the man. He's the guy that can make these changes. And so I want to start to wrap this up, and I want to ask you, if you're listening to this, to take a moment to go online, take a moment to look up your senators, your congressmen, and to write to them or phone call them. Usually when you do the phone call, it goes to a machine and you can leave a message, but phone them or email them and tell them that you want Bobby confirmed. You want him to change the way things are done, because the way things have been going, the way the trajectory is still on target for, is not healthy. It's not healthy for any of us. It's not healthy for you or your family members or your kids. It's not healthy for America as a country to continue down this path, because the health of Americans is far beyond and far below what other industrialized nations are. If you compare America to other industrialized nations when it comes to health statistics, we rank really low. America should be number one. We talk about America as number one for so many things. We're number one for obesity. We're number one for chronic disease. Okay, those are things that we don't want to be number one for, because not only are they hurting the health, happiness, well-being, longevity, how we live our lives here in America, but it's also hurting us as a country financially, and it's hurting us as a country for future generations to be strong and continue making America a great country. We're damaging that. So, you know, we're wrapping up here. I really hope you got something out of this. I hope I was able to reach you with information that helps you understand this process and understand, you know, what's happening with this, because there really is a lot of, you know, when we talk about the corruption, there's a lot of that happening here. A lot of it is happening here. Keep tuning in. Please follow along with this program. I'd like to see my followers grow so I can reach more and more people, and continue making this the best podcast for all of us. So until next time, this has been the Flip Side. Thanks for joining us. Bye-bye.